Welcome, everyone. It is 12 o'clock, so we're going to get started. Welcome to Mental Health KC Presents to our webinar today. I'm Jamie. I am with Metro Council, and we're so excited to have you guys today. We're going to tell you a little bit about Metro Council, and then I'm going to go on to introduce our incredible webinar speakers. So a little bit about Metro Council. We are all of the community mental health centers in the Metro. That is what we comprise of. So that includes University Health, Swope, Rediscover, Comprehensive, Beacon, which used to be Tri-County Mental Health Center, Johnson County Mental Health Center, along with Wyandotte Behavioral Network, along with Center for Behavioral Medicine and Mental Health America of the Heartland. So we all encompass Metro Council, and we have educational programs along with other opportunities to collaborate as a whole Metro. So we have free webinars such as this on the second and fourth Thursday of the month from 12 to 1 that are free. And then if everyone could please save the date, we have our very large mental health KC or Mental Health Kansas City conference that will be coming up May 23rd and 24th. We have a new venue. We're really excited. We're working and going to be having our location at Johnson County Community College this year. So we are able to grow. So with that, we have so much more room. We're so excited. We have two incredible keynote speakers, Corey Keys, Dr. Corey Keys, who's going to be talking about languishing, and then Wesley Hamilton will be talking about overcoming adversity into resiliency. And Wesley Hamilton is local. He has a incredible nonprofit called Disabled, but not really. And if anybody's ever watched Queer Eye for the Straight Guy, he was on there as well. So we're so excited for our keynote speakers. And then we have 70, you all heard that right, 70 breakout sessions around everything around behavioral health that you can think of. So we actually will be talking about 988, which is what we're going to be talking about today. But we're actually going to have a whole panel talking about 988. We'll have every topic you can think of around mental health, behavioral health will probably be discussed at this conference. So, and on top of that, you get 8.25 contact hours for the day and a half training, and it's only $50. And with that includes lunch, snacks, and then 8.25 contact hours. So save the date. We try to make this as accessible and as affordable as possible. We know that things have gone up a lot in price. Our conference has not. So come join us. So with that, couple little quick announcements. We are using Zoom webinar, which means that you are able to see the presenters, but not yourself. You will be able to connect through the chat box and Q&A. So if you have questions, definitely put them in the chat box or the Q&A. And then at the end of our time together, I will give you a link and a password to get a certificate of attendance with 1 contact hour. So you are able to get that at the end. And then quick little disclaimer, the views and opinions presented are those of the speaker and do not necessarily represent the opinions of Metro Council. But with that, I'm really excited to introduce 2 individuals from our Metro Council organizations. So we have Laurie Cox and we have Michelle Rogers, and I'm going to tell you guys a little bit about them. So Laurie Cox has a master's in social work from Louisiana State University and holds a clinical license in both Missouri and Kansas. And she's worked in a variety of settings within the mental health field and during her career of almost 40 years. Laurie's primary focus has been crisis intervention and community mental health. She's been part of the Missouri's crisis intervention system since the late 1990s, and she's currently the director of crisis services at Swope Health Services. So welcome, Laurie. And then we have Michelle, and Michelle Rogers has over 30 years of experience in the mental health field, starting as a caseworker with outpatient mental health services with the state of Missouri and earning her master's degree in counseling psychology from UMKC. and becoming clinically licensed as a professional counselor in Missouri. Over 15 years was spent completing crisis interventions in the emergency room at University Health, formerly Truman Medical Center. And she's currently program director of specialized services at University Health Behavioral Health, which includes the crisis prevention team, which is located in the University Health Emergency Room, mobile crisis team, intake and engagement team, hospital diversion and disease management team, projects for assistance and transition to homelessness, and the justice involved team. So really excited to introduce both Laurie and Michelle. And with that, take it away.
All right, give us a minute to get our screen up here.
Okay, so we're going to talk about 988 and mobile crisis response. So Missouri has a crisis continuum, and what that involves is having people in need to have someone to talk to, someone to respond to them, and somewhere to go. So we're going to focus mostly on having someone to talk to and someone to respond. That's what we're most involved with. So 988 is the someone to talk to. It's a 3-digit number that you can call, text, or to chat when you or someone you love, or I guess just a neighbor or a friend are experiencing a mental health, alcohol, or substance use crisis. Immediate support is available. It's 24/7. You can be connected with the mental health professional to address those needs in the moment. Overall, it reduces healthcare spending and reduces the use of law enforcement, public health, and other safety resources.
Yeah, and something else that we also want to make sure that folks understand is that it's not just if someone is suicidal or homicidal. Some folks think that it's that closely related to 911, but the reality of it is the individual defines what a crisis is. And so if their coping skills for whatever reason are not working for them in the situation that they're in, we're the perfect number to call, because there they can get that kind of assistance. So it does not have to be so acute as to actively be suicidal.
So what to expect when someone calls 988? The 988 call specialists are trained to handle crisis calls. They're ready to listen and to provide whatever help you might need. You can request specific call specialists to focus on people who are veterans, who speak Spanish, or are seeking gender affirming support. It's free, it's confidential. The conversation is between you and the call taker. So you can share as much or as little as you want. They might have prompts to get you to share, but what you decide to share is up to you. And then the support doesn't have to end with the conversation. They can provide referrals. The mobile crisis team might follow up the next day with the phone call. You can be provided with next day behavioral health appointments. So there's a variety of ways that it can go just from that one 988 call.
And also, when it comes to dialing 988, it's important to know that right now we do not have the geo tracking in place. So when the call hits the suicide prevention hotline, and that's the national hotline that's located up in the New York area, it's going to route the call to a local crisis hotline based on area code. So if the individual is in Kansas City, but they do not have an 816 area code, let's say they have a 785, their call is going to get routed over to the Lawrence area as opposed to our crisis center here in Kansas City. So it's important to let the call taker that answers the call know that the individual is in Kansas City and needs to speak with someone in that call center. That way, mobile can be dispatched if it's needed, and that call center would have the resources that the caller might need. So just to know how that kind of works. So when it comes to mobile assessments and interventions, most calls are handled by the actual crisis line. Only about 10% of the calls actually get routed over to mobile. Some of that's because like our call center has not traditionally had the option of a mobile outreach. And so they have learned to manage so many things by phone. But again, most of our callers are calling just needing resources or a listening ear. But when they do require a face-to-face intervention, then ComCare, who is our crisis line locally, they have the ability to reach out to our mobile teams here in the Kansas City area and provide us the information on where to meet that individual. They do discuss it with the caller to make sure they're comfortable for someone to come out to their location. And then we work out a safe place to do that. And the mobile teams are trained mental health professionals. They are really experienced with managing crisis situations in a community setting as opposed to within a mental health center. Can be very different in those two different setups. And they are very versed in the community resources and how to connect people to additional services. Because as we all know, once you resolve that immediate crisis, a lot of times if you don't link into other services, then you come right back to that same place over and over and over again. Some of the mobile teams include peer specialists. All are working towards that because we find that those with the lived experience can sometimes better relate to the individuals that we encounter. And so that is definitely a goal of all teams to add that.
Yeah, and if a mobile response, if they can't decide on a safe place, or if the person prefers that they not have a face-to-face, the mobile crisis response team can still talk to them on the phone and give them those resources and contacts. It might just be that the person calling doesn't feel like it's a safe place, they don't want to have somebody show up there. So they can make other arrangements for that as well. So mobile crisis response as a statewide, response system, it generally is multidisciplinary, 2 or more individuals. The person might have a master's degree or a bachelor's degree. We try to include peers, although that's not the case at every agency. Try to provide 24/7 coverage. There's some timing that we try to respond to calls within 10 minutes and get to the site within an hour. Minimizes law enforcement, accepts all dispatch requests from 988 or ACI.
Yeah, and ACI is the crisis line. That's the calls that they were initially set up to receive. So that's just kind of Missouri's term for the basic crisis line. But it is important to communicate out to folks is that we do not bring law enforcement with us. They are not a part of this response. If a situation is such that we feel their presence would be helpful, we're going to have that discussion with the individual. We're not just going to blindly send law enforcement out to where they are, because that's generally not what people need.
Yeah, and the goal is always to promote stabilization in the least restrictive environment. So, we want people to stay at home. And so they'll go to great lengths to try to come up with a safety plan that is going to make that happen. If they need additional resources, then we can look at that. Or if they need some wraparound services, additional support from a caseworker, or maybe they need an early doctor's appointment, they can help arrange that or try to.
Yeah, and if sometimes what's needed is to remove them from the situation that they're in. And so if there is another place that they can go to get away from the situation, we can assist with transportation for that. Now, not every team is available to do that. Not every agency that has mobile teams, but speaking for Swope and University Health, our team does provide transportation in those kinds of situations. And although another goal of ours is to avoid hospitalization, again, keeping them in the community and stabilizing things there are those times when hospitalization is really the best option or the only safe option. And in those situations, when it is safe to do so, we can also transport to the hospital, which saves them from an ambulance bill and, again, law enforcement involvement and all that kind of stuff.
We also coordinate with the mental health agency. So like if somebody is in service with either Swope or University Health and this call, they have a call to 988 after hours, we can coordinate that care, follow-up care with the staff during the day.
And we also connect to other agencies, whatever the resources are, again, as Michelle mentioned. And we do as much of that through warm handoffs as we can, in the sense that we will help them make the phone call. Or we may call and then, connect them in, depending on what the situation is. That can be a little bit more challenging after hours when we don't have that ability. But if a warm handoff is going to work better for the individual, then our after hour folks will pass it to the day shift, who will then help make those calls. And again, make sure that we are connecting them in the most effective way so that the individual is comfortable and will follow through. So, and our teams are trained in trauma-informed care, trauma-sensitive practices, de-escalation, and harm reduction. Those are just some of the few things that we train them in. One of the other things that we wanted to highlight for you today is that Swope and University Health have entered into a very unique collaboration. This is something that is not being done anywhere else in the state. And so we want to just kind of give you a little bit of information about that collaboration. What you see on the screen right now is the logo that we created for our mobile teams. It's on the shirts that they wear. We've got it on the side of our vehicle, so that we're not identified as law enforcement or emergency services or anything like that. But it's one way of pulling the two teams, the two agencies together into one team. We initiated this collaboration at the very beginning of our preparations for 988. So this started late 2021. We began talking, and the leadership, the executive leadership of all the agencies in the Kansas City area had some conversations. We were encouraging some overall collaboration. But everybody was in such different places of getting their teams going and how their crisis programs functioned, that it was Swope and University Health that pulled together and formed this first collaboration. And so we did have to bring our senior leadership on board, obviously, before we could move forward. But our agencies have worked together on a lot of different programs already. We run a lot of similar things, and so we come together for various problem solving. So it was a very logical collaboration for us. We've worked together for so long and know that we have that common treatment philosophy, and we share some initiatives. And then just having the creative thinkers on board. When we pulled together, it took us quite some time to pull it all together. It was more involved than I thought when we first came into this. And so it became a very interesting growing experience. I was very impressed with the transparency between the two agencies, because as we hit different problems or challenges, to be able to say, whoa, this is somewhere where my agency is not quite as strong, and the other agency saying, yeah, that's a strength of ours, and being able to share those things, as well as even as we continue with this process, when someone does something that's not the most desirable in responding to a situation or some decisions that we make, for us to, again, we come to the table without the blame, accepting ownership for what we're doing, and how do we improve our setup and make things better. So that's been a really cool process in sharing, just the things that we're learning and how that is making both of our crisis programs stronger, as well as the mobile team that we have going together. It has not been without its challenges. I have to say that most of the challenges have been with finance and IT, probably. But because it's changing a way of thinking. Because when I tell my finance people that we are paying part of an invoice, I send an invoice and they go, why are we only paying? Well, because University Health has paid the rest. And they're just like, I don't understand. As well as sharing equipment and those kinds of things. So it's just been very interesting, how we've had to also kind of educate other areas of our agencies so that they kind of understand how this collaboration works, and that, yeah, it's very different from anything we've done before.
Well, and we're also working on collaborating more with co-locating at university health offices and sharing a van that we can use to provide transportation and getting all of that. People co-trained because some are officially university health employees and some are Swope employees, but then they have to go through some
Right.
form of orientation with university health in order to get badges so that they can have access to this location. So, but I think that pulling them together is going to provide a more cohesive and positive response when they get called out.
Absolutely. Absolutely. And the ideal is that every time we send a team out, one of those team members is a Swope staff and one of those team members is university health. And so that's generally how we set our teams up. So, and we respond to both service areas. And so we butt up right against each other anyway, and people move between the two. And so it just makes sense for us to share that.
And then we also developed some shared policies and procedures. As things came up, sometimes we'd be like, oh, we should have a policy on that. So like you said, the transparency and the coming together, we just are came together easily to discuss those issues and come up with policies.
And so this is just some of the benefits to this collaboration. To the individual, again, we've talked about this non-clinical setting and getting out there into the community, not requiring them to come into our facilities, and actually working with those that typically show up into an ED to not do that, to give us the option to come out before you walk into the ED. Law enforcement diversion, and the unnecessary expenses that come with, EMT involvement and those kinds of things. And I think probably one of the more important ones is that this sometimes gives us access to natural supports. When we meet the individual in their environment, then we sometimes have the opportunity to meet other people that are there, and how can we optimize those supports. The agency benefits, we've talked about some of those already. The staffing and the training, Michelle mentioned the shared resources, the combined expertise and strengths. And I have to say that this was really highlighted this morning as we are working with an individual that's very, very challenging for us. She's calling 988 quite frequently. And it's resulting in a lot of calls to our mobile team, and we're just kind of stumped as to what to do about that. And so to be able to come together, both of our agencies pulling expertise from some of our other staff, and to be able to sit down and say, okay, here's an approach we can take. And so again, being able to draw on that expertise and the strengths in the two agencies has just been amazing.
And the community also benefits because we have a high standard of care, and they'll hopefully know what to expect when they come out. And most importantly, we really want to relieve the first responders and the hospitals. We would prefer that people call 988 and let us provide an appropriate response and try to resolve the situation in their home or someplace safe in the community, rather than having them, go to the expense and the time to go to the emergency room where they may sit for a while before they're seen, and maybe they might not even get those needs met.
There's also another collaboration in the Kansas City area that we just want to make you guys aware of, because I think this is also going to bring about some pretty amazing changes in the crisis system in our area. We obtained a SAMSHA grant. Oh gosh, we're in year 2, I believe, of this grant. MARC, Metropolitan, Mid-America Regional Council. Sorry, y'all. They are the ones that are administrating this grant for us. And it involves all of these community mental health centers that we have listed here. And what has been so amazing is that it has brought us to the table to have conversations about those expectations. Our goal is that when anyone comes to, calls the 988 and a mobile team is dispatched, that wherever they are in Jackson County and the surrounding area, that they get the same response regardless of what team goes out. And so this has brought about a lot of conversations about what our teams do and when will they go out and when will they not go out.
What they'll do when they go out.
Exactly. And how to follow up, and also how to connect, because it could be, I mean, those of you that are familiar with Jackson County, the service areas in Jackson County for Department of Mental Health, it can be very confusing to figure out which agency do you call. And so ComCare, who is again our hotline in the area and the one that dispatches our mobile teams, sometimes they do dispatch the wrong one because the lines are very close. And so the agreement that we've come to is we're not going to say, not ours, please call Comprehensive Borough. We're going to say, okay, and we go. And then we can deal with that difference the next day. And we make sure that the individual gets connected to the correct mental health center. But it has helped ComCare as well as all of us. And this is something that's very unique. And there's no one in the country that has access to this. We have such a tight relationship with ComCare. And for those of you that don't know, ComCare is actually made up of the community mental health centers. So all of us came, across the Northwest region, and I think there are 7 or 8, came together and formed ComCare way back, I think in the 70s. Don't test my direct knowledge of that, right? So we already have a link with them, and they've been doing our crisis hotline for a long time as well. And so the SAMSHA grant, although they are not a recipient of any of the SAMSHA funds, they are a part of this collaboration, and that they attend our meetings, they participate in those. And we were able to sit down with them and outline when would be an appropriate time for their call takers to pass something over to mobile. And so again, there's no other call center in the nation that has that opportunity, and that is willing to have those conversations and to adjust their processes to meet those kinds of expectations. So that has been really awesome part of this. And then we are now expanding to include law enforcement and EMS.
Yeah, well, we say that mobile crisis responds without police, and we want to make that clear that the police aren't necessarily going to be involved. The police might actually answer a call and be on site and then call 988 to take over. So they might be there, and a 988 mobile response person responds to the scene and kind of takes it over, and the police can then leave. So we do collaborate with the police if they have somebody who's calling a lot, or if they just need us to, it's a call that should go to 988 instead of a 911, or they clear a scene and there's an event that's of such traumatic nature that they want a mental health professional. They have contacted 988, and we've had mobile dispatched to follow up.
Yeah, to support.
And we may be adding EMS to our mobile response teams. So that's something that we're in discussions.
Yeah, we're having some conversations about that.
Yeah.
And the other thing that we're doing with law enforcement is that we are working to help them, and they've already started. The big challenge was when they get those mental health calls into the 911, we wanted them to be able to transfer them over to 988. And we had a lot of struggles with that initially. It's kind of a hard thing for them to wrap their head around. I think they are so responsible and concerned with the folks that they get the calls from that they really were kind of reluctant to pass that on. And so we've had a lot of conversations. ComCare has been in there meeting with them, talking with them, understanding their process. And there is now an MOU in place between ComCare and KCPD's dispatch, where they will transfer calls to 988. And so that has been a really nice growth in this area. We are working to be able to place a mental health clinician within their dispatch center, so that they have that immediate person that they can pass things to or get some feedback from and that kind of thing. So a lot of really good conversations are coming out of this collaboration. So that's been really nice to see as well.
Okay, so just delivering mobile crisis services. This is some of the data. Most of the 96% responded to in less than an hour. That means from the time that the mobile crisis people are contacted, they've arrived at the scene within an hour. We average about 27 minutes. So we try to get there as quickly as we can. 75% was resolved in the community. Nobody was transported to jail or prison or the police department as a result of a mobile crisis contact. And less than 1% resulted in involuntary transfers. So, but no restraints. So we have tried to limit hospitalizations and involuntary, transfers as much as possible. And I think we're being, really successful with that.
Absolutely. And something else in line with that is that when CommCare contacts our mobile folks and say, hey, this person would like a mobile outreach, we immediately turn around and call the individual, not to verify that, not to ask all kinds of questions and say, well, maybe we don't need to go. We call to say, hey, we just got notified from the crisis line that you're needing someone to come out and talk to you. My name is, we're on our way. We'll be there in 20 minutes, whatever, so that they know that we're coming. We may also ask some questions about safety. The crisis line has already asked questions and determined it to be safe, but sometimes we have some follow-up questions based on the information they got. So we may ask some questions about that. The only time that we would not go would be if it's determined that that location is not safe. And if that's the case, then we're going to discuss with the individual about, can we meet you somewhere else in another location that's determined to be safe. We also will not go if the individual does not want us to go. So we don't just show up blindly on people's doors offering our services. They have to be in agreement, which kind of leads to something we didn't mention earlier, not real specifically, is that we do respond to third-party callers. So if someone calls the crisis line concerned about someone else, could be a neighbor, could be a family member, whatever, but that individual that they're concerned about is not willing to talk to us, does not want anyone's services, but this individual is concerned, then we will go out to that individual and talk with them and how can we assist them to manage their relationship or their interactions with this individual. Now, if it's a neighbor or someone that's right there and they go to the individual and they introduce us and then the individual decides they want to talk to us, awesome. We will go ahead and engage with that person. But if we show up, and we've done this before, and the individual says, yeah, no, I'm not talking to anybody, then there's no more we can do with that person, but we will assist the concerned individual.
We can also provide that third person caller with resources, or if it does involve, something more, we can help them walk through whatever options there may be.
Yeah. And here's some more, just some data on the calls that have come through. Most of them you will see are not suicidal. And so that's, again, we want to emphasize the fact that that's not the sole purpose. We are to assist with any mental health needs. And by acute mental health crisis, again, we're talking about something where the individual has identified that they are in crisis. How they normally cope is not working for them. They're not functioning as well as they would like to function. They need someone to assist. And that's basically what that is. A lot of what we do is responding to that, referrals, handing out referrals and other things that will meet their needs. And then, yes, there are folks that are suicidal that give us a call. And one of the examples that I do like to give is that we got one call from a young man and the team went out, and what he revealed to them was that he was seriously contemplating suicide, had gotten on the internet and Googled how to kill myself. And yes, options pop up. So he had that, but the other thing that popped up was that box that said 988 and encouraged him to call. And he chose to call 988. Our team went out, met with him. He was so grateful that they came out. And they were able to link him into some services. And so, yeah, it works. It's pretty awesome. It's one of my favorite success stories right there.
That's a good one.
Um,
All right, so we talked earlier about the crisis continuum. A person to call is 988. Someone to respond is going to be mobile crisis, and somewhere to go. We have these crisis stabilization units. That we have 3 in the general Kansas City area. There's the addresses and phone numbers. So we do utilize them when, if we respond and somebody needs some support, but not necessarily a hospital. KCATC is open 24/7, as is the comprehensive and Compass, I believe, are open 24/7, that you can contact them. Like I said, Laurie said, we provide transportation, but I assume others have ways of getting people there. Some do. The urgent care center on Blue Ridge Boulevard serves both adults and youth. So that's a big advantage there. So if you have somebody, a youth that needs someplace to go, they can connect them with resources from there. I think they generally have physicians that can prescribe medications, but the urgent care centers are only open from 9 to 9. I meant to check that.
I'm pretty sure that's accurate.
Okay, so. And these are all of the CCBHOs that were together to form this SAMSHA grant to provide consistent care.
And I hope y'all have a lot of questions, because we got finished early. So we're ready to take questions.
So we have quite a few questions. One is, and I'm just going to go in order. So guys, any questions you have, please put them in the chat, or you can put them in the Q&A. We'll get to all of them. So what is your suggestion for an adolescent that resides in St. Joe that may have a mental health crisis? Or any child under 18 and over the age of 5? Does 988 work with them?
Absolutely.
So kind of 2 different questions. Suggestion for adolescent St. Joe and children overall.
Yeah, and 988 is an option.
National.
St. Joe does have a community mental health center that provides mobile response. And in fact, Family Guidance has been doing mobile response for, I don't know, 100 years. No, probably, well, I don't know, maybe that long, but probably not. They are used to going out into their community all over. Yeah, and have a good handle on resources. And as with all of the mobile teams, we respond to adults and kids alike. And yeah, so we will go out, we will link them into resources, the whole gamut. Does that answer the question? I think.
Okay. So next question, how is the data collected from all the different entities involved?
So each agency, so like Swope and Rediscover and Comprehensive Rural, everybody submits their own data. We have specified collection point or questions that we're wanting in, data collected on. So then we all submit our data, and then SAMHSA kind of, or MARC coordinates it.
Yeah, and Department of Mental Health also receives data from us every month. So for those of us that are part of the SAMHSA grant, we're reporting data to 2 different places. What we send to DMH also goes for the SAMHSA grant, but then we've added a few things on top of that. So there are very happy data people in the state of Missouri that are working on all of our data.
Yeah.
And we are working to make sure that we are very consistently reporting the same information across agencies. That has been a challenge, because we've always reported data on our crisis system. And sometimes it's left to interpretation as to what, facility may mean for location. And then we have this other field, and what are we putting in other? And we get to talking and find out that people are doing these things different ways. And so we are continuing to tweak that so that our data becomes more and more solid and consistent across the state.
So we're using shared definitions
Mhm.
of what things mean.
So next question. This is a zip code question. As a case manager in Independence, I was given the ARC mobile response as our specific mobile mental health mobile team. Hold on, it just moved. There we go. So I was given the ARC mobile response as our specific mobile mental health mobile team. Is there a jurisdiction where another service is active in Jackson County, or do community members have a choice of mobile response?
Yeah, I'm not familiar with ARC. I'll say that straight out. I do know from some conversations that we were having yesterday as a part of the SAMHSA grant that there are some others perhaps that are out there doing some mobile stuff. I can say that the community mental health centers are the only ones that are connected to 988. So, yeah, that's how we would be reached. Yeah, the others, yeah, and again, for us, we do have designated service areas according to the Department of Mental Health. I personally am hoping and praying that goes away because I think it kind of complicates things, particularly for law enforcement and for the average individual that has no clue what any of that means. But the bottom line is, if you call the 988 and you get routed to ComCare, they're going to dispatch the closest, most appropriate mobile team. Yeah, and so that's the only answer I have for that.
Yeah.
But I would love to know what ARC is.
I thought there was an ARC in St. Louis.
I apologize. It's ARCH, so
ARCH?
Alternative Response to Community Health.
Okay, so that might
And,
just be something
I don't know that one.
specific
And
to
Cynthia,
Independence.
thank you, Cynthia, for explaining it a little bit more. It's a joint program between the Independence Health Department and Independence Fire Department.
Oh,
And they
interesting.
respond to low acuity 911 calls in Independence.
Oh,
Many of those
okay.
are mental health related.
Gotcha.
So it says we're
Okay.
dispatched through Independence 911 and also provide follow-up visits following the initial event to make sure that folks are connected to the services that they need going forward.
Okay.
Nice. Yeah, I'm hoping that there is some collaboration between that group and Comprehensive Borough, because Comprehensive Borough provides the community mental health response for that area. But and all of us are beginning to talk more and more with our fire departments and with our EMS folks. So I could see them tag teaming on that. But that sounds like that is something that you would reach through 911, which again, the purpose of 988 is to pull some of the load off of that already overloaded first responder system. And also folks that are not necessarily as well versed in mental health as perhaps may be needed for the call.
I got some more questions. I love it. Thank you, guys. Okay, so we have SOS, Signs of Suicide Day, at the high school I work at each year. Would we be able to utilize the mobile response to help further assess if a student needs hospitalization or help find beds? We do a Columbia rating scale, and if they score in red, we ask the parents to pick up and take to the ER for further assessment and possible hospitalization.
Yes, we absolutely could respond to that. We would hope that the parents could also be present, or at least we could talk with them on the phone and all of that. And my personal opinion is that may be a better option, just because sometimes once you get to the hospital becomes the only route. And sometimes that's not the most appropriate. And so to give to give a mobile team the option to work with the youth and the family to perhaps find some other options for keeping them safe
Mhm.
rather than going the hospital route.
Yeah, because hospitalization and going to the ER, that can be kind of traumatic,
Mm-hmm.
especially for a youth.
Yeah.
Okay. So we got some more. So as an organization that has a crisis call line for substance use resources, I'm curious what texting platform 988 is using. We'd like to add a HIPAA compliant text option to our organization.
Okay. And that currently all the texting goes through DefLead. And I am not sure what platform that they use. We could certainly get that information out to you. ComCare does not do the text just yet. So that's the only
It's
answer we have.
contracted out.
Yeah.
With that.
With DefLead. So.
Yeah.
Next question. Are you aware of the new REACH program in KC? If so, do you think there could be any collaboration?
Yeah.
Yeah, I think there's
Mhm.
room for collaboration. with that.
Absolutely.
Yeah.
Yeah. And we had some conversations about that in our SAMSHA steering
Mhm.
committee yesterday, wanting to be able to do that in the hopes of preventing a duplication of services. And also confusion
Mhm.
to the community by throwing in another number. How do we help folks know which number do you call? So yes, we absolutely want to collaborate.
Okay, so next one. Is there a timeline for implementing geo-tracking? We frequently hear stories of calls being misrouted and
Mhm.
difficulties in connecting to the correct service area or even sometimes correct state.
Right. Yeah, I wish I could tell you it's going to be done tomorrow or even next month, but I cannot. The last update we had is that it is being worked on.
Mhm.
When we go out and train, we generally provide both numbers. We provide the 988 and we give how that works and some of the concerns that could come from that. But it's also important to know that our crisis line number is still in service and will remain in service. And so for our area, if an individual calls the 1-888-279-8188, they will go directly to our crisis center. And their call will be handled the same as if it had come through 988. So particularly if they don't have an 816 area code, that will route them straight into ComCare. The other thing to consider is that when calls bounce from the suicide prevention hotline, if they send it to ComCare, but all of ComCare's call takers are busy, it doesn't hit their queue. It then goes to the next closest call center, which for us is generally St. Louis. I think there's one in Springfield. So, just whoever happens to have an opening. So again, currently, the only way to be sure that you're going to land with ComCare, our local line, and stay there is to dial the 888 number. Because if you hit there and the call takers are busy, it's going to fall in their queue. And the data that they provide us and the experience that we have had and have heard is that you don't sit in that queue for very long. They are very well staffed, have staffed up to manage the additional calls that are coming through on the 988. So that would give you a direct line in.
Laurie, Michelle, can you repeat the crisis line number again? We have somebody asking if you could repeat it again and then also put it in the chat as you're saying it.
1-888-279-8188.
Thank you. Okay, so we have a few more questions. So the library is in desperate need of your services. What's the best way to partner to get our patrons the services they need when in crisis?
The what?
The libraries.
Oh,
Libraries. Yeah. We've put some information in some libraries.
Yes.
Um,
Reach out. We'll come
Yeah.
to you.
Yeah.
I don't know what to say.
Yeah, absolutely. I mean, you can call our agencies directly, and we can work on those collaborations for sure.
It is a point that our group is trying to do some outreach, and the libraries are at the top of the
Mhm.
list. We did contact one of the libraries recently. So yeah, if you contact one of us, we'll make sure to move that up on the
Mhm.
list, because we do have our mobile crisis staff are more than happy to go to agencies if they're not out on a call and just educate the agencies and the staff about what 988 is and what to expect and how to
Mhm.
access and what we're good for and
Yeah.
all that. So we're happy to do that.
Sorry, guys, I'm stuck in myself. Okay. Next question. How is the determination that the space is a safe place to go? Are there screening questions about that? Is there a list of commonly used alternate meeting places?
So generally, we're looking at having animals that are not going to be a problem. We ask about weapons. We ask about other people in the area.
Mhm. Yeah, if there might be something going on. I know we had one call that we went on and there was a domestic violence situation going on. We're not gonna get involved in domestic violence. But and we ask those questions about, do you have, an animal that's potentially dangerous? And if, would you please make sure that the animals are contained?
Mhm,
If you have weapons, would you please make sure that the weapons are put away?
mhm.
And if we are assured of that, then that's not a problem. But if we show up and there's a attack dog out front, yeah, we would be not getting out of the vehicle and calling and saying, okay, what else can we do here? Kind of thing. So it's mostly those types of things. And we do like to be aware of who else is in the home. Um, again, for the safety of our folks, our teams, that they know who is there and is there anybody that we need to be concerned about? Will anybody be coming in and out of the home? Those kinds of things. We've not encountered very many situations at this point that have made us say, yeah, let's meet somewhere else.
Yeah, alternative locations might be a park or
Mhm.
a restaurant or coffee shop or a store, that's
Mhm.
just open and nearby. I think we did have somebody who was close to our office and they just came to our office, even though it was after hours. Um,
Yeah, and we've met in the park and by the river and yeah. Again, it's just those basic safety questions and our staff are trained, on how to keep themselves safe and what to be aware of and mindful of. So it's not a real extensive safety screen that we do. It's just enough for us to have an idea of what's going on in the community and, whatever location the individual's in.
Okay, back to the library. We have another question.
Okay.
So if we call on behalf of a patron at a library that's going through a mental health crisis, but they do not express that they want someone to come out, would that hold up the process or could they still come out to assess them?
Well, I think it's kind of like what Laurie described earlier. We could come out, we could talk to the caller, get some information, and then if the caller wants to approach the patron and introduce the staff, that would be a route that we could go.
Yeah, but if they don't want to talk to us, obviously we can't force the issue.
But we could maybe try to start building a
Mhm,
rapport
right.
with the patron
Absolutely.
so that they might feel more comfortable if they meet with our staff, Monday, Wednesday, and Friday, maybe by Friday.
You're right. They're feeling comfortable enough to
Yeah.
talk to us about what's going on and to accept some help. Absolutely.
Because part of it is doing that follow-up after an initial call. Everyone's supposed to be followed up on
Mhm.
within 72 hours.
I said, thank you, that makes sense. Okay, so next question. At what point during a 988 call would a clinician offer mobile response or does the person need to ask for it?
I think generally, as they're talking with the individual, that maybe the individual shares what their main concerns are and the the call taker is discussing with them some different options, and none of that seems to be what the individual is looking for, then they will discuss that as an option. You know, I think it's kind of, obviously every situation is different. And so if it's any point that they get the sense from the individual that this phone conversation thing's really not getting it, they need to actually sit down and see somebody face to face, then they will toss out that option. We do encourage folks to ask for that if that's what they want. They could call, 988 and say, hey, and just give a very brief, synopsis of what's going on and say, I'd really like for your mobile team to come out, and they will call us and dispatch us. But if they don't know to make that request, then the call taker is going to do it based on their sense of what is going to alleviate the individual's need the quickest. And again, if they offer it and the individual says, no, I don't want anybody coming to my house and I don't want to meet them anywhere, then they'll continue to do what they can do by phone. Or they may say, okay, so how about if I have someone from the mobile team just call you to talk to you, because they can help link you into their agency. They may be able to answer any of your questions or concerns about getting involved in outpatient services at that agency and that kind of thing.
Okay, so one person said, I think this training live would be very helpful for public library staff. Would you be
Absolutely.
willing to take this training on the road?
We
Absolutely.
could do that, yeah.
Yeah. Just reach out to us and we'll
Yeah,
set it
we'll
up.
figure it out.
Okay. Well, thank you guys so much for your time. I know we still have a few more minutes left, but I do want to thank you all. I want to thank you guys for answering all those questions. A couple of people have asked if you could please share your email addresses in the chat.
I think it's on the slide.
And
Yeah, maybe on the slide.
maybe
but
it's
they
the
don't.
next slide.
Oh,
That's my bad. Uh-oh.
well, we might be having issues.
Oh,
Oh,
there it is.
is.
There we
Yeah.
go.
Our phone number
Excellent.
even.
Woo!
Yeah.
Okay, so anybody that might need Michelle's email or Laurie's email, now it is on our screen. So plenty of time to still ask a question if you have one. But I just want to thank both of you so much for your time, for your willingness to come together to talk about 988. I know I learned quite a bit more about what 988 can do and mobile crisis response. And I love the collaboration. I love the fact that like two organizations were able to come together and really work collaboratively. I think that helps our community as a whole. So thank you guys so much for coming and speaking. For those of you that need or would like a certificate of attendance, I am now putting it in the chat. And so all you got to do is click on that link and put in the password and you are able to get the certificate. So thank you all so much for joining. Our next webinar will be the second Thursday in April. So that is April 11th. And it will be with Kathleen Harris-McCoon talking about Remarkably Resilient. So thank you guys so much for your time. Thank you, Laurie. Thank you, Michelle, for
Thank you.
being amazing presenters. And everybody have a great rest of your day.
Thank you.
Thanks.
Thank you.